this is Ume, registered nurse. Today I am going to talk about antibiotic overview. Antibiotic overview, which is working against bacteria. So I'm using mnemonic antibiotics. A is for accidental pregnancy, N is for no alcohol, T is for toxicity, ototoxicity and nephrotoxicity, and then I is for intake probiotics, B is for blood clot and peak levels, I is for intake healthy diet, O is for part 2 sensitivity, T is for take a full course, and I is for intake lots of fluids, C is for check cultures, S for serious side effect needs to be monitored closely. So antibiotic mnemonics. A is stand for accidental pregnancy. So take additional contraceptives such as IUD or condoms, because few of the antibiotics reduces the contraceptive's effectiveness. So we just have to remember that 3C is C is for saline, C is for cycline, and C is for child care. So saline, penicillin, and then cycline like a tetracycline, those kind of medication can causes accidental pregnancy because they reduce the effectiveness of the contraceptives. So 3C we have to remember. And then for the pregnancy and child care, like a women who are childbearing, pregnant, and who are breastfed, so they have to take a precautions and they have to talk to the provider in order to take those medications. Next is N, means no alcohol. It may reduces effectiveness and also can interfere with some antibiotic and exacerbate side effects. Next is T, is for the toxicity, ototoxicity and nephrotoxicity. So we need to check the renal function for the kidney function before administering any antibiotic, especially patients who has history of renal disease. Also need to monitor for patient is on mycin. So mycin as the group of the medication is the vancomycin, fluoxetine, etc. So need to monitor closely nephrotoxicity, such as is the creatinine and BUN level. So this is very important that we need to check the creatinine and BUN level, especially if patient have kidney disease and if they are in mycin group of the medications. And also for the ototoxicity, monitor for the tinnitus and vertigo. And next is I is intake probiotics. Antibiotics may cause GI upsets such as nausea, vomiting, diarrhea, because they kills good flora from the gut. Can cause secondary infection, which also called the superinfection, such as the Clostridium difficile, CTIF. So we need to take the probiotic while you're taking the antibiotic, because of the antibiotic is very powerful. They kills the good bacteria in our gut, and then it can make the infection, which called the superinfection. So we have to keep an eye on it. Next is B, stand for blood throw and peak levels. If throw is too high, it is indicate of kidney toxicity, and if blood throw is too low, that means infection is growing. So creatinine level more than 1.3 and BUN greater than 20 needs immediate attention to the healthcare provider. So B is blood throw is very important to monitor when patient is on antibiotic. Next is I, stand for intake healthy diet, which helps to build the immune system, and also it helps to recover from the infection quickly. Next one is O for photosensitivity, which is the sunlight or the UV ray sensitivity. So I remember from the nursing school is no fun in the sun. FUN fun stand for fluoroquinolone, tetracycline, and sulfur drugs. So if you taking those medication, you should not go to the sun. It can damage your skin, and then how you can prevent this damage of the skin. So reduce exposure of sun, wear sunscreen even in the cloudy days. This is one of the NCLEX important questions. And finally, wear long sleeves, hats, and sunglasses. That will help you to prevent damage your skin. Next is T, stand for take a full course of medication. So do not stop taking medication even when you feel better or symptoms is improving. Otherwise, secondary infection or super infection may occur. Next one is I, stand for intake lots of fluid with medication. Antibiotic can cause side effects like diarrhea, which can lead to dehydration. So this is very important to take lots of fluid while you taking antibiotic. Next is C, stand for check culture and sensitivity. So before take the antibiotic, to identify what medication patient needs to use for the specific infection, to find out the specific antibiotic, because there is a broad spectrum and narrow spectrum. For the narrow spectrum, we definitely need to do the culture and sensitivity test. Finally is S. S stand for serious side effects need to monitor closely, such as hives, raised rash, shortness of breath, swallowing, face or tongue, which called the angioedema, wheezing, coughing. Need to stop medication immediately and call the provider, especially if you are working in the hospital setting. If it's the IV medication, just right away stop medication and then call the provider for the further investigation, further assessment. Let's recap antibiotic mnemonics. A is stand for additional contraceptives method needed and is no alcohol. T is toxicity, autotoxicity, and nephrotoxicity. I is intake probiotics. B is blood throat and peak level, and I is intake healthy diet, and O is photosensitivity. T is take a full course. I is intake lots of fluid. C is check culture and sensitivity. S is serious side effect need to monitor closely. We already go over the antibiotic overview. Now is the time for the practice questions. The questions number 1 is the development of a new infection as a result of elimination of normal flora by the antibiotic is referred to as what? This is the answer is superinfection, not the resistant infection, not the nosocomial infection, not the allergic reaction, because superinfection can happen when you take the antibiotic, so they kills the good bacteria from your gut and then can cause the secondary infection, which is known as superinfection, such as C. difficile, Clostridium difficile. Next one is the nurse should include which instruction when teaching patient about diglycycline. It's like tetracycline therapy. So number 1, use sunscreen when you are outside. Number 2 is if you have diarrhea more than 5 times a day, and number 3 is avoid using the drug if you are pregnant. So as we know that tetracycline is no fun in the sun. So tetracycline, fluoroquinolone, and sulfur drug, those three drugs can damage your skin when you walk to the sun or exposed to the sun. So that's why you have to prevent our skin with the sunscreen and the hats and and the long sleeves clothings and the sunglasses. And the pregnant woman needs to take the extra precaution. They need to talk to the healthcare provider if they wants to take this medication while they are pregnant or they are planning to pregnant. This is one of the important questions for the NCLEX. Next one is which instruction should nurse include discharge teaching for the patient who is start taking tetracycline? The answer is use sunscreen and the protective clothing when patient is outdoors. So I already discussed previous questions answered that if you taking those medication, you always need to put the sunscreen and then long sleeve clothing, eyeglasses, and not to expose to the sun, and then you need to protect your skin. That's about the everything. So next question is, so 30 minutes after receiving the intramuscular or the IV penicillin, a patient reports itching, redness at the injection site. Which action should the nurse take? Select all the apply. So number one, if it's the IV, I will definitely stop infusion right away and then call the provider. And also if you have available, administer subcutaneous epinephrine. If it's the hospital setting, you can also call the rapid response teams. They have the epinephrine available, or if the patient already have the epinephrine, we can give the epinephrine first before we call the provider. So just we have to monitor the patient. So next is, this is one of the basic nursing questions, that before you administering intravenous penicillin, the nurse should do what to do. The correct answer is assess patient for the allergy. So if we can ask the patient if they are allergic to the penicillin or any other medication, we need to ask the patient that if they are allergic to that medication, if they took it before, so that way you know. So the other flush IV site, normal saline, review patient intake at output, determine the latest creatinine clearance result is not necessarily important. Definitely if there is a vancomycin or other medication that affect on the kidney function, we definitely need to check the BU and creatinine level. So next one is, which data intervention is needed by the nurse when provider care a patient who is prescribing with vancomycin? The correct answer is creatinine over 1.3 level. Blood urea nitrogen 12 is the normal level, and then echomesis is for the bleeding, and the red PGA around the chest is not important. So if you are in vancomycin, tobacomycin, those are the mycin, those are kills kidneys. So that's why we need to monitor the creatinine 6.6 to 12.12 milligram per deciliter, and BUN is 8 to 20 milligram per deciliter. If it is the creatinine greater than 0.12 and BUN above 20, risk for nephrotoxicity, so we need immediate HCP attention, so they can check the kidney level, and also they can change this antibiotic to the different types of antibiotics, so that their kidney is not much stress. Next one is, an adult female has been prescribed for doxycycline for a chlamydia infection. She is healthy and her only medication is an oral combined contraceptive. Education would be include is a use a backup method of birth control until her the next menses, because the birth control pill can antibiotic can reduce the effectiveness of the birth control pills, so that's why they need to use the additional methods such as non-hormonal contraceptives such as IUD and condoms. I already talked about the A is for the additional contraceptives when it comes to my mnemonic, so you can go back and check again. So next one is, a patient will begin taking streptomycin as a part of the medication regimen to treat tuberculosis Before administering this medication, the nurse will review which laboratory value patient medical records. Definitely blood, urea, nitrogen, and creatinine. Because as we talk about it, blood, urea, nitrogen has to be 8 to 12, 8 to 20, and then creatinine is 0.6 to 0.12. So if is the more than 0.12 creatinine and more than BUN is 20, it can kill kidney. So that's why we need to monitor patient renal function test. Next one is when prescribing flagyl to treat bacterial vaginosis. Patient education would be include consuming alcohol in any form may cause a severe reaction. So patient should avoid the alcohol because it may reduce the effectiveness of the antibiotic. So other option is metronidazole is safe first trimester of pregnancy. Sexual partners need concurrent therapy. Headaches are the sign of serious adverse effect reaction and need immediate evaluation is not correct answer. So definitely patient need to avoid alcohol during taking any kind of antibiotic because it reduces the antibiotic effects. Next one is a nurse providers a care of patient who came with the animal bites and on IV piperacillin. Patient is complaining of stomach upset and nausea. Patient wants to stop medication for a few hours and requesting for the antiemetic medication. Which response is correct for this patient? Definitely is number C. Yes, you have right to refuse your medication. I will prefer to give PRN antiemetic medication because of the patient has right to legal rights and self determination. So we have to respect patient autonomy and legal rights and self determination. So we also can follow up the patient that why patient need this medication because we don't want patient have any super infection. So whenever she feels better, we can give the medication. We just need to talk to the patient. But if they are refusing the medication, yeah, they have rights to refuse, and we should listen and respect their autonomy. So bye bye nurses. Hopefully it helps with your nursing study and for the NCLEX. I'll see you next time. Bye bye.